Welcome to PUBH 700 Perspectives in Public Health. I'm Michael Bird and I'll be your guide as we briefly explore the role of environmental sanitation. Life expectancy in developed countries has increased from less than 50 years in 1900 to nearly 80 years today. The greatest improvement occurred in the first half of the 20th century, when life expectancy in the United States and many parts of Europe increased by an average of 20 years, largely because of the universal availability of clean water and safe food and rapid declines in infectious disease. Romans developed the first ever system of public health. Roman government was based on a foundation of providing clean water, clean and safe food, and clean air. Roman settlements, such as army camps, were sited in healthy places and not near swamps. In other places, marshes were drained, which reduced malaria. Much of what public health does goes completely unnoticed. Yet over the last 200 years globally, the great advances in life expectancy and health come not from medical care, but rather from public health improvements. Another important role of local public health departments are the prevention of foodborne illnesses. When certain types or numbers of illnesses are reported to physicians, public health investigators look for connections. They look for pathogens that could be transmitted through fecal, oral routes, or by food. Investigators look to see if victims have something in common. Specimens are collected and sent to the laboratory. Routine restaurant inspection programs are the very best way of preventing foodborne illnesses from occurring in the very first place. Restaurants are routinely inspected to assure safe handling and serving of food. Another example of the activities of local public health departments is mosquito control. Mosquitoes are the deadliest creatures on earth. Publicly funded programs of mosquito control have prevented most of the deaths in the U.S., but worldwide mosquitoes cause millions of deaths annually. Examples of diseases transmitted by mosquitoes are West Nile disease and malaria. Adequately funded mosquito control surveillance and education are the best ways to prevent diseases caused by mosquitoes. It's paramount that we eliminate mosquito breeding sites on our property. Rabies is one of the most deadly diseases known to man. Rabies has the highest case fatality rate, but it's 100% preventable if people know what to do. Therefore, the major activities of public health are assuring the vaccination of household pets and public awareness and availability of prophylactic vaccination. Each year, over 55,000 people die each year worldwide, but because of public health measures, there are relatively few deaths in the U.S. Again, knowing what to do in the case of a potential rabies exposure is crucial. An important role of public health is improving public awareness of the dangers of rabies. We have allowed entire generations of children to be exposed to lead. Many years ago, lead was used as an octane booster in gasoline. It's still in the environment, and also it was widely used as an additive to paints. Monitoring of levels of lead in humans and in the environment and abatement of lead where it's found to be present are important public health activities.